We are in the midst of a mental health crisis that needs more attention. New data shows the large toll that the pandemic took on students' mental health, with 7 in 10 public schools reporting a rise in the number of students seeking mental health services. Only about half of those schools are able to effectively provide the necessary help for these children. Joining me now to discuss is Dr. Pete Loper, pediatrician and child and adolescent psychiatrist. Dr. Loper, welcome back to the show. My first question for you is, did the pandemic bring long-standing mental health struggles to the surface, or do you think it did create new struggles for students? What's really going on here?
You know, it's a great question. I think it's both and, but I think that the key word here is isolation. We were already in the isolation epidemic prior to COVID-19. The pandemic has exacerbated the isolation that many of us were already experiencing prior to the pandemic, specifically our children, our school-age kids, and our adolescents. So it's isolation that's been exacerbated in the context of the pandemic with school lockdowns and school closures.
You know this well, Dr. Loper, but late last year, a state of emergency was declared when it comes to the mental health of children and adolescents. What specifically led to that call?
Yeah, so it's been, in October 2021, it was due to a dramatic uptick in the number of emergency room visits for children and adolescents, specifically for mental health complaints. And so that's something that I work on the front lines. I work in an acute crisis stabilization unit, and we saw that trend occurring well before October of 2021, and certainly in the height of the pandemic.
The survey was conducted, it's important to mention to our viewers, before the tragic elementary school shooting. Now, Governor Abbott attributed mass shootings to mental health. With that said, he also slashed nearly $211 million from a commission that oversees mental health services in Texas. I want to mention he's not the only governor that has done so when it comes to mental health services. But what's your reaction to that?
You know, it's interesting because regardless of how we define this problem, the fundamental phenomenology is isolation. Unless we're willing to acknowledge the degradation of community and the loss of sociocultural construct that helps support our children's healthy development, it doesn't matter how we label it. And, you know, we know that sociocultural construct, it starts in the family of origin. It's embedded in a supportive community. And mental health resources are a big part of providing that support for our children's healthy development, but so are our school systems, so are supporting our parents and healthy parenting strategies and those types of things.
I want to get your opinion on something that many mental health experts are saying. They're warning that blaming incidents solely on mental health issues is inaccurate. It's harmful. What do you say to that, Dr. Loper?
Yeah, you know, it's tough. When we're talking about the most common mental health issues like depression or anxiety, we really need to understand that these are not, this is not simply a chemical imbalance in the brain. This is a human being with an unmet need. And particularly in the context of the pandemic, the most common unmet need was meaningful interpersonal interaction embedded in the context of community for our children. And so we have to acknowledge that. And so what we understand is that just like when you withhold water from a human being, when you withhold meaningful interpersonal interaction from a human being, pathology will ensue. If you withhold water, kids become dehydrated. If you withhold meaningful interpersonal interaction embedded in the context of community, children develop mental health issues and adults develop mental health issues, not the least of which are depression and anxiety.
What are your tips for supporting our children's mental health, especially after a tragedy?
Yeah, so in the context of tragedy, there's 3 different strategies that we really recommend. So first and foremost, we have to conceptualize the fact that with tragedy this severe, it can be very traumatizing. So the first step is to prevent. You want to prevent exposure to the trauma. And so you want to really limit the news cycle for your children. Adults as well. We understand that you want to also prevent re-traumatization. So the more you watch that news cycle, the more prone you are to become traumatized by that experience. It's something called collective trauma. Those who live in communities where violence has really been on the rise are going to experience this trauma in the context of the violence that's occurring in their own communities. And it's going to augment or amplify those symptoms. So the first step is to prevent. Second, you want to support your kids in processing the trauma. But before you do that, we always suggest that adults put their own oxygen mask on first, just like in the airplane. Put your own oxygen mask on first before you support your kids. If you're an adult and you're struggling with the distress of this tragedy, seek support, seek help, and then go be with your kids and helping them process. The best way to do that is to create a safe space for them to ask questions and then to provide honest and open questions, limiting the degree of information, particularly with those younger kids.
I have less than a minute, but I do want to ask you about students who may not be receiving the mental health assistance that they need, whether it's from family or from their schools. What advice do you offer these kids or their caretakers?
Yeah, so seek those services and be aggressive in trying to seek them out. The other thing too is this has got to be a community approach. And so one of the most important things that we can do for our children in the context of a tragedy like this in particular is empower our kids to reach out to those classmates within their classroom setting that may be struggling, that may be having a hard time, feeling isolated, may have compromised sense of self-worth and a compromised sense of value. We know that when a human being doesn't feel like they're of value, they have a hard time valuing the lives of others. And so empower our kids, boots on the ground within the classroom to support those who may be struggling. And then parents, be assertive, and school staff and faculty, try to identify those kids and get them the resources they need.
Great advice. And thank you for sharing some insight here. Dr. Pete Loper, pediatrician and child and adolescent psychiatrist. Thank you so much for that.